one of the things our clients used to ask me, especially, is like, how old are you? So not only am I a Black woman, but I'm a millennial. And often in the titles that I carry um, and the people that I work with, there was a large age. So not just in terms of being a Black woman, but also a large difference in terms of age. So how do I show up? I show up as Jimica, and I there's this book that I love when it comes to being a professional, and it's called The Thin Book of Trust. Um, and it talks about basically, showing up and being competent, showing that you care. Um, all the attributes, I would say, are some of the core attributes you should have as a professional. So you're not going to get, just like you meet anyone on the street, they see you, they don't know you, they just see the outside of your book.
Hey friends, welcome to Public Health Careers. I'm Emory Richards, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Jimica Tchamako. Jimica is Director of Business Unit Informatics at the Task Force for Global Health Incorporated. With over 15 years of experience working in the health sector, she's passionate about digital transformation strategies and making positive impact in the global community. She conferred a Bachelor of Science in Human and Organizational Development, International Leadership and Development, and Political Science from Vanderbilt University, a Master of Public Health in Informatics, and a Master of Business Administration from Emory University. In today's episode, you'll hear and learn more about her journey into public health, why understanding the problem and engaging stakeholders are key in managing change when adopting new public health technologies, how sustainability in implementing software and systems in public health organizations requires buy-in from people within the organization, how public health is about more than disease prevention, it's about fostering thriving communities and improving quality of life, how an MBA offers a broad view of public health and the role of business in building communities, and why leadership as a Black woman in public health is challenging, but confidence and authenticity are essential, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hey, this is Jimica Tchamako. I am a business unit director in informatics at the Public Health Informatics Institute, which is a program of the Task Force for Global Health in Atlanta, Georgia. And you are listening to Public Health Careers.
Jimica, welcome to the show.
Thank you. I'm super excited to be here, Mari.
I'm excited to have you and to hear more about the work that you're doing and how you've gotten there. And before we get into anything, would love to know, how do you identify, and tell us a little about your personal background.
So I use she and her pronouns. I identify as a Black woman. I grew up in the South. I actually grew up in a rural part of Alabama, a very small town called Pittsview, Alabama, as well as Phoenix City, Alabama. I grew up with my parents, grandparents, and I grew up in a very large family. I currently live in Atlanta, Georgia, and I love to travel. I love being outdoors, and I love spending time with friends and family.
Well, before I get back into rural Alabama, I would love to hear, like, what's the favorite place that you've traveled to?
Oh, that is such an unfair question. I work in global health. So I will say I've had the pleasure of traveling to 6 of 7 continents. I don't have any plans of traveling to Antarctica. So to answer that question is difficult. So I'll just say it this way. One of my favorite places to go is definitely East Africa, East and South Africa. It is a great way to just get away and get outdoors because I love being outdoors. I've worked there over the years. So being around the people and the food and the culture is truly an experience. I would say I also love to travel to technically Central Africa because my husband has family there as well as in Europe. So those are some of the other areas that I enjoy traveling to.
Well, when I'm thinking about my Africa trip, I'll definitely reach out to you for some recommendations.
Awesome.
And you also mentioned that you're from rural Alabama. I would love to know how that has kind of influenced your perspective on like public health or just how you show up in this world and in this work.
It's honestly had a huge impact um, on my work and my passion within global health. And when I think about global health and public health altogether, I think about population health. I think about access and opportunity, specifically having access to quality care and a quality lifestyle. So growing up in the South, in the rural part of Alabama, having access to local clinics and healthcare facilities was not always easy, as well as hospital systems. So I saw firsthand what that means for a community not having easy access to varied resources and how that can impact a population. So I do see or have a very personal connection, I would say, to understanding the importance of healthcare and systems and programs, so understanding social determinants and outcomes, particularly growing up in a rural community.
And as we learn in the conversation and your journey, that you have extensive experience both in public health and with a business perspective, having the MBA as well. So I would love to know, how do you approach change management when implementing new technologies in healthcare settings, and what strategies have been most effective?
Right. So I always like to start with a big picture in mind, and really ask the question of, what are the challenge or what are the problem we're solving for, and why the change is important. And so understanding that is really important before you kind of develop any type of approach. And so when I think about an approach, once we've answered those questions, and I think about an approach, I have this kind of framework that I build off of. And this framework is people, process, tools, and policies, because those are all the areas that will be impacted when you're talking about change. So understanding the people, the process, the tools, and the policies are so important. So we start out, and particularly in my work, we start out with requirements and what requirements are, what are the organizational needs, what are the potential technology needs, what are some of the process needs, what are the resource or the people needs, as you think about implementing and adopting change within your organization. So beginning to define those things is important. And as a process of defining that, engaging stakeholders is very important. So that collaboration between who your key leaders are, the influencers, the decision makers within the organization, as well as the people that are doing the work and having an understanding of the work that they're doing and how they're potentially going to be impacted by change is so important as you think about implementing technology within any healthcare or within any setting altogether. And having a baseline understanding of those things and moving into what I really like to focus on is a clear understanding, doing business analysis and doing a clear understanding of the current state of the organization. So when you're defining the organization in terms of what those workflows are, processes that are in place, the people that are in place, or whatever systems or tools support that workflow, and the policies or the business rules that are impacting that workflow, and then beginning to define out from that current state to what your future state desires are. So your future state design is really important in terms of setting you up with your architecture or your blueprint in terms of where you are and where you would like to go. So once you have this blueprint or this architecture very defined, is so important, because from there, it's not necessarily so much about the tool per se. You do want to make sure that whatever tool or system you adopt does meet your requirements, but you really have an understanding of the work, what the needs are, what are some of the expected outcomes, as well as how you're going to measure success. And a lot of times we think about change and we think about adopting tools and technology, but again, what problem are we solving for, and then how are we measuring success once we implement that change. So those are some of the key things that we think about. So once we've developed our business architecture, what we ultimately define, this blueprint, our business architecture. Once we define that, we have the opportunity to then think about what technologies will support this work, and you just kind of go through the normal process of development or adoption of a tool, testing and rollout. Again, involving all the right people, making sure that there's a real communication plan, piloting as needed. So, not a full scale rollout and adoption, but making sure the solution that you put in place are really going to meet the needs before you have um, some a larger rollout, and potentially run into some challenges and unnecessary pitfalls, I would say. And we can have a whole conversation about implementation pitfalls, but I know that's not what this is about. But those are some of the things that leaders think through. But what I really want to hone in on is the constant communication of the change. So making sure at the leadership level that there is clear buy-in and acceptance and understanding of what that change process will look like. Making sure even at the middle level, those that will be impacted by the change, what it means for them, and they have the right communications level, and then just communication throughout as you move through your work plan of adopting. So those are some of, at a very, I would say, high level, some of the things. But people, process, tools, and policies are all impacted when you're looking at implementing new technologies, and those are the things that need to be evaluated and defined.
I like how you highlight like you have to think about what is the problem. You have to think about what are the successes that we're looking at, and what is the future state that we're trying to get to, and then kind of like working backwards in doing that. But that was very helpful for someone that might be thinking through, how do I create that type of change that I want to see in my organization or in the work that I'm doing. And I would love to hear maybe one example of implementation pitfalls that you have seen, or maybe just challenges in doing implementation of this work, that might be helpful to someone.
Yeah. So at PHII, we have a trademark methodology called we call it CRDM, which stands for the Collaborative Requirements Development Methodology, and it really focuses on doing the business analysis, redesign, and the development of the requirements. A lot of times our partners question whether or not we need to spend time doing requirements analysis and understanding what the needs of a system will be to support the work that they're doing. And gosh, because of the time commitment to do this work, sometimes there's a lot of pushback. Why can't we just adopt? I just want Tableau, or I just want whatever the latest and greatest system that's in the news, or that has come up in conversation. And that might not be what you need. So sometimes what I've seen in terms of a actual example is that I've seen clients, not do the requirements part and do the business analysis and understand how these systems will support their workflow, and just adopt a system. And now there is lack of buy-in for that system because people don't understand it. People don't know why, all the functionality, how it's really supposed to support the workflow. There's not a clear understanding of how it's being designed to fit within their existing workflow. So some of that functionality is underused or overused. So there's just a lot of complications that come with, bringing a system into an organization and you haven't done the work to really understand how it fits from an architectural standpoint, in making the work more efficient, or being able to get access to a different type of data set that you may not have been able to do, whatever your reason or rationale is for bringing on that new system, without understanding your requirements and understanding your processes and um, making sure that you have a plan for your staff in terms of who's going to support that system. Negating those things are just a huge pitfall when it comes to adopting and implementing a new system.
That's fascinating, and I think it is so true that you have to have like the conversations and the buy-in from people, because you can have one person that's super excited to bring in, for example, Tableau, and to think about all these different features and how they could use it, but then you bring it in and then other people aren't bought in, they don't know about it, and they end up using it like at 5% of its capacity, and then is that really the most effective and efficient way to do the work? So really love that you're thinking about how do we engage throughout the entire process, and even more so is how do we communicate the changes and communicate what we're hearing from that feedback and those conversations in the work.
Exactly.
And then shifting a little bit here, so how do you see digital transformation shaping the future of public health, and what role does informatics play in that evolution?
So, um, today, digital transformation, as well as words like AI, um, are just a huge focal point. Um, all industries are being challenged to understand how they can do things better and how they can adopt systems to support that. So, in a nutshell, I again, asked a question of, what are the questions and answers that we need in public health that digitized systems can support us in getting. And so we start there. So um, I think about our challenges. What are some of our challenges right now in public health? Data silos and system silos. So lack of interoperability, the ability, a lot of things are still in some areas in paper form. So the inability to quickly access data, or the ability to not really be able to analyze data, big data sets, in the quickest fashion. Those are some of the challenges that we're seeing in public health. So when I think about digital transformation, I think about improved data collection and analysis. So how we're turning raw data into actionable insights. So we're collecting data faster, we're collecting it cleaner, better processes. In terms of how we collect that data, and the ability to get that data into the hands of the right professionals from a decision making perspective. So, whether you're on the policy side, or whether you're a practitioner, or whether you are, someone in the field that's really trying to understand what's happening around this outbreak, how quickly can I understand how many cases I have potentially, where those cases are located, how can we begin to kind of put some of the measures in place to prevent spread. Those are some of the things that I think about when I think about digital transformation is our data. How do we get it? How do we collect it better? How do we analyze it better? And how are we able to use it better? I think the other area is looking at opportunities from a technical standpoint of how we're able to really identify patterns and trends from large data sets. So one of the things that I'm working on right now is this concept around One Health data. So this is looking at human, animal, climate, environmental, and any other types of data, and being able to integrate that data through the various systems. And a lot of these systems are siloed systems, but being able to collect and integrate those systems in a way that we can begin to see other different trends, particularly in areas that might be dealing with more change in their client, or they might have a higher degree of a prevalence of certain types of disease instances. So I think there's just a lot of opportunity again as we think about how we collect, analyze, and use data. Then the last area I would just touch on, because I think it's not so much about collecting, analyzing, and using data, but is about what are the interventions, how are we preventing, and then how we're just ultimately improving the quality of life in communities. So very much at the local level. So, how can we have more localized and tailored interventions at a community level and identify risk at a higher level of precision for specific populations? So, I'm really excited as we think about aggregated data sets that, may tell, depending on the catchment area you're looking at, but how can we get even more granular and precise as we look at um, different communities in terms of what their needs are and create more tailored solutions instead of a one size fit all type model that's been used in the past.
And I feel like that's a big part of the conversations that are happening in public health is around data transformation and creating the infrastructure and the system so that we are able to better understand, apply, tailor, and use data to address a lot of the issues and the challenges that we do face in public health. So definitely, I recommend like anyone that's interested in public health and working in public health to think about how they can learn skill sets around data management, data analysis, because those are things that are going to continue to be valuable going into the future.
Yeah. And can I just give you one more tidbit? And I just have to say this. We're becoming just as a society, as a global community, we're more interconnected. And so the idea of silos and not able to have data at the right levels for timely response and just prevention altogether is something that I hope um, we can move away from as we continue to innovate within in technology and allow for technology automation, um, artificial intelligence. I know sometimes you say that word, some people cringe, but let me say it from this next lens, which is doing it in an ethical way. Um, so moving ethically as we uh, develop systems to help better manage and use our data from a global perspective. Because regardless of borders, and I understand we have to have borders, um, disease and other things don't necessarily adhere to that. And I think for many people, at least the last public health crisis was evident of that. So I do want to be really clear about that piece, that we are a connected society. And from a technology perspective, I think we have a lot of opportunity to do good um, in increasing and improving the quality of life for everyone, regardless of where you live.
Yes, a lot of opportunity for sure. So, Jimica, what does public health mean to you?
So my simple definition is definitely keeping populations healthy as we think about disease prevention and preparedness and response, but also just thriving. I think that keeping populations healthy and thriving is something that's really important. The thriving piece really focuses on quality of life. So outside of, you know, just, pathogens or diseases, it's important to note that, your well-being, just as a human, is important. So public health plays a huge part in that for me.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at thephmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show. Yeah, absolutely. Because too often we think about health only when we go to the hospital or only when we're sick, but we have to think about health as, do we have sidewalks outside to walk safely? Do we have lights outside? Do we have a park nearby? Do we have clean water, etc., etc.? So I greatly appreciate that. And then moving into your collegiate career, so you got your Bachelor's of Science in Human and Organizational Development, International Leadership and Development, and Political Science from Vanderbilt University. So walk us through that thought process.
It's actually quite interesting. I started my career in engineering actually at Vanderbilt, and I have this joke. I went to every school at Vanderbilt except for Blair School of Music before I landed on those majors. But I started out in engineering because I wanted to study computer engineering. But as I got more into university and allowed myself to just explore and be, my majors changed. And human and organizational development, studying abroad, I spent my junior year in Australia. And there I actually got introduced to public health. I worked with an organization that focused on HIV/AIDS, and I was actually a street collector. I collected donations, and I gave out educational material to the people of that community. So I learned a lot about public health in that setting and in a global setting. So eventually came back, and I wasn't, focused on engineering so much anymore. I had a new focus and just kind of wanted to do something different.
And were there any experiences that you had during undergrad that you wanted to talk about? If you wanted to dive more into that study abroad experience or any others?
Um, I think my experiences in undergrad were many.
Okay.
So I'm not sure exactly which ones do you want me to focus on, the organizations I was with, my like how do you want me to take this conversation?
I'd love to hear maybe a highlight of some of the work that you did with those organizations, or maybe if there was a formative project that was very helpful in shaping some of your thoughts, then happy to hear more about those.
Okay. So in undergrad, I participated just in a lot of organizations on campus. We started Alternative Winter Break. I was a part of Alternative Spring Break. I was a part of um, an organization that started Kids and Computers. This organization focused on we collected broken computers or different computer parts, and we rebuilt those computers, and we brought kids in, elementary students, middle school students, and high school, just kind of depending on where they were, and trained them on how to use computers. And at the end of the program, those computers that we rebuilt that were donated, we gave them to those students. I was a part of Delta Sigma Theta Sorority Incorporated, and I did a lot of work in the community with my sorority. I actually was the president of my sorority. But I would also say my time in Australia, my junior year, was probably the most formative time for me. It was my first time living abroad, so not in the States. So I was definitely far from my family. I created a community. I lived in a Jewish house, actually. It was an international house, but it was a Jewish house, the Mandelbaum House. And students were from all over the world. So different religious backgrounds. I grew up Christian, but in my house, people represented all faiths. And so I had some of the most interesting conversations with my housemates, I would say, um, in regards to life, the purpose of life, who we were, you know, 19, I guess, 19, 20 year olds. Um, we went out a lot. We traveled. I traveled um, through Australia as well as New Zealand. And I just met people from varied backgrounds, and I was integrated into different cultures. So my time studying abroad was probably, again, the most formative because it really shaped a lot of my perspective and gave me insights to just because you may have grown up in a different place, or you may have grown up in a different faith, or with just a different culture and background. um, there were so many similarities between us, and we didn't focus on our differences. We focused on things that brought us together and our likeness, I would say. So finding common ground in some ways in terms of our social community. So I would say, again, being in Australia is really what gave me an appetite to be in the global space. It gave me an appetite to think about public health and global public health, and um, how people either thrive or didn't thrive, just kind of given their resources and where they may be from.
Yeah, I can imagine just how formative that was, and it seems like you had great experience and relationship building with people who can really discuss like the humanity and see like, oh yes, we are humans and we have all these things and similarly, and we also have these things that are different, and I think that's beautiful in itself. Were there any big takeaways that you had from undergrad?
I would say my biggest takeaway from undergrad was just, you know, be curious. Again, I was in the College of Engineering, the College of Arts and Sciences. I was at Peabody College. So I was in three schools at Vanderbilt, and I had the opportunity to take classes, varied classes. I met different people on campus and when I was abroad. Um, and so much of that, I even did my internship at at the Tennessee General Assembly. I actually did my senior internship um, with the Senate, which is a part of the Tennessee General Assembly, the 105th Assembly. So, at one point I was going to law school. At one point I was going to be an engineer. Um, and so I actually came out a consultant, working working in healthcare consulting, doing revenue cycle and working with IT systems. So my advice would be to stay curious and just remain open to learning from your peers and get to know your peers. Like a lot of my closest relationships today as an adult are with people that I went to Vanderbilt with, and we have amazing memories in our young adult years. So get to know your peers, stay curious, don't feel like you have to have it all figured out, um, and explore, try new things. Um, if you like something and you feel that it's a calling for you, that's why I learned that travel was definitely my thing, and the global community was something I was excited about. That's okay. It might be different from what your family um, may even expect of you or may have experienced, um, but that's okay.
Yeah, absolutely have to be open to the opportunities and be curious, and to the point of, even if you're thinking about becoming a lawyer, becoming an engineer, like as you learn and as you experience and as you grow, you're able to find yourself and take all those experiences as you were going down those paths and combine it all to where you are. And so you graduated from your undergrad and you said you went into management
Graduated on
consultant.
time. I may have went through multiple schools. I did graduate on time.
Hey, you got it done. That's what's important. So then you moved into a management consultant role at Huron. Can you
Mhm.
tell us maybe how you came across that role and more about what you did?
Again, relationships, because my senior year I was planning to go to law school, And I had such a supportive senator, and rest in peace to Senator Thelma Harper. Um, she was a big part um, of my senior year, my time in terms of thinking about law school. But um, at the end of that internship, I had two things in front of me. I had my experience in my junior year in Australia, and I had my experience with the Tennessee General Assembly at the Senate. And I knew that coming off of that internship that I didn't want to go into law. And I just said, you know what, I'm going to take a step back. So, like a lot of my friends at that time, I graduated in 2007, um, had, they were going to grad school, or they had already done rounds of interviewing with consulting firms or whatever firm they were going to go and work for. But I was at a place where, you know, preparing for law school, and then ultimately decided that's not what I was doing. So I actually went home for 2 months. I went home for 2 months, and I worked at a local college, Columbus State University, in their study abroad office. And I just spent time thinking about what I really wanted next for my career. And because of my relationships and relationships I had built on campus, I was able to talk to just a lot of people about what they were doing. So, consulting really combined my love for travel, wanting to do something within the health space, and then still having a love for systems, even though I didn't pursue fully computer engineering. So, I had a conversation with one of my peers from Vanderbilt. Such a great conversation, and they were like, "You should really try this company because they're doing late round interviews." And I was like, okay. So I put in my application, didn't really think anything of it, and I get a phone call. And not only did I get a phone call, but I got this like very rapid schedule. If you know anything about consulting interviews, there's like a number of them, case studies and all that great stuff. But I got this schedule, and it just happened so quickly. I went through all of the interview rounds, did my final round of interviewing. And I would say it was definitely less, about 30 days from the time I put that application in to the time that I received an offer. And from there, um, it all began. So.
That's beautiful, and I love that you took time to like step back and kind of reflect and figure out like what you wanted to do, as well as having had those relationships that you've cultivated before that was so helpful. And you never know who you're gonna have a conversation with that's kind of gonna influence or push you over the cliff on doing something. So that's awesome that was able to happen for you.
And I will say, Omari, that so many of my friends were worried. Not so much my mom or my family, but they were like, "What are you're at home? Like, what are
Mm.
you doing with your life?" So again, it might not feel comfortable in terms of where you are for any of, depending on who's listening to this. But it's okay to step back. It really is.
Absolutely. So what kind of work did you do?
So I actually work in revenue cycle, and so from that perspective, I did revenue cycle operations, where we work with the hospital, with those systems, and improving their processes to improve basically their revenue output. So, um, as a part of improving their processes, we brought on information systems to help understand what was happening with those financial accounts, and what was happening from a process standpoint. And there was like key performance indicators that we would be reviewing on a weekly basis to understand just kind of how much is expected, how much pending revenue, and where the opportunity gaps were, just in terms of following up on those accounts and working with those accounts. More specifically, I work with around insurance. I worked on what they call front end and back end of the revenue cycle. I work with self-pay populations. I work with Medicare and Medicaid, so on the government side of billing and follow-up. So I did all things revenue cycle within in a hospital setting. So I learned a lot about IT systems. So people, process, policies, and tools is really where I honed in on that concept. And so you asked a question earlier about change management, and so understand how currently an organization is operating, and then implementing or adopting a new system into that process, what it really looked like from a policy, especially when you're dealing with laws like HIPAA, as well as business rules, depending on the payer rules, and then working with the people within that organization to gain buy-in for the adoption of those software and systems and processes. Because at the end of the day, it's the people there that's going to be operating and using those tools. So I always think about sustainability of any change process really starts from the beginning, and how you start the process and how you manage the process through by bringing those folks along who's eventually going to have to manage those systems once that process or that project period is ending.
And then you moved into a senior business analyst role at Emory University.
Yeah.
And I believe you also got promoted in that role to the business unit director for the Informatics PHII, I think it is,
Yes.
which is one of your current roles, if I'm not mistaken.
Yes.
So can you walk us through that process of getting into that senior business analyst role, and then what do you do, and then what did that progression look like?
Yeah. I had a phenomenal time in consulting. At the time, I was traveling 100% of the time, based out of Atlanta, but working domestically across the U.S. At some phenomenal health systems with some very smart people. That was great to be around. But I came to a point in my career where I was questioning what was next. And so I was looking into doing an MBA program at the time. But, I'm a person of faith. And so, you know, being in prayer about what was next for me was so important. And doing something more in the global space was really, really important. So, what actually happened was I had an opportunity to do an international project as a part in consulting. We work with Habitat for Humanity International, and I went to El Salvador. And in El Salvador, we built homes, and we integrated with families. And I got to know this little boy named Charlie. And Charlie wanted to be a surgeon. Um, and basically everything about, a lot about where his community was in the resource setting, it just seemed like it would be a difficult thing for him to be able to become a surgeon just because of the circumstances. But I was so inspired by his passion and just his zest for life. So I knew at the time in doing that work with Habitat that I wanted to do something in the global space, and I wanted to be something very purpose driven. So that really shaped my path in terms of not going directly into an MBA program, which is more the natural path when you're in management consulting, but doing something different. So I was in Portland at the time, and working out in Portland, and I ended up walking by this graduate fair, and Emory University School of Rollins was at this affair and graduate school affair. And I had this conversation around their public health program, and I got introduced. And Melissa Crancer, she's out there and she's listening to this. We had a lot of conversations, and over the period of a year, we stayed in touch. And, I eventually said, you know what, I actually want to pursue my MPH. And so from there, I think that's where everything kind of changed. So my experience, so my second experience in the global space, um, and just kind of being curious and getting to know Emory and the School of Public Health. And they had just a program that I just thought was super perfect for me and my background, doing applied public health informatics, doing my master's focused in that. And so once I got accepted to the program, I knew that I wanted to, because I was on an executive program, I didn't want to become a full time student again. That was just not appealing to me. So I wanted to get both experience as well as what I would call the theoretical in terms of the coursework. So I came I accepted, got accepted to the program. And then from there, through the program and getting to know more about being at Emory and some of their affiliates, I got, um, um, I found the Public Health Informatics Institute, the Task Force for Global Health. And so it's just kind of, I got into my MPH program and then I transitioned into an actual position here at the task force. And, at the time, it was a step back in my career, just in terms of where I was in consulting, but it was a step back in terms of my career. But it was the right pivot for me. It was the perfect pivot for me. Um, Being a senior business analyst, my background in working with health systems and processes, and implementation of those systems was just a perfect fit for me to come over and be able to hit the ground running and do what I did well when I was in consulting, and then also be in a graduate program at the same time in terms of learning public health and learning the concepts around it. So basically, I like to call it learning the language of public health. At the time was just a perfect marriage.
Well, I appreciate you sharing that. Would you mind sharing more about that, maybe that thought process on you intentionally, quote unquote, taking a step back or pivoting in your career? Because I could imagine that there might have been some self doubt or things that are kind of creeping into your head as you're thinking through that process.
It was, I think, you know, consulting is a up or out. At the time I was in, it may have changed now, but it was very much up or out in terms of your career. And being a millennial, and you're always thinking about what's the next jump or what's the next title, the next salary, right? We all have to live and survive. So you know, that is, I believe, where my faith comes into play, and what, you know, um, in prayer and talking to God about what's next. I think, every point of my life, me ending up in Australia, how I pivoted in undergrad, how I was just open, even in my journey through consulting and the different types of projects and people I work with. I just stayed open and stayed curious. So when the opportunity came for me to come to Emory, be a part of the public health program, and then also have this really cool job with what I consider to be a very dope organization, to work in public health, at the heart of public health in terms of being in Atlanta. We're on Emory's campus. CDC is their major partners within the global health space that they work with, like WHO, the Gates Foundation. I can name so many. I was like, this is a true opportunity. That's one part of it. This is the other part that I really have to call out. I got an opportunity to work with someone um, that I felt was very similar to me. My boss, Vivian Singletary, is just an amazing mentor in my life and in my career. So taking on this position would be under her, and I got to know her, and I just felt like it was just a great match. So it wasn't so much just about the opportunity itself when it came to the work, but I care so much about the organization that I would be working with and the people that I would be working with. So when I got to know my boss, Vivian, and got to know the other team members and some of the work that they were working on one of our larger projects around child health and mortality prevention. Um, I was just excited. I was excited for the community that I was, because I was leaving a strong community in consulting, and I was excited to move into to the next community where I felt like I would be supported and I felt like I would be valued in my work. So it wasn't so much about the step back. And sometimes we have to just um, clean our lenses and look at the opportunity for what it really is in front of you and what's also important to you. So, from a lifestyle perspective, I also had just gotten married and I didn't want to be 100% on the road. So, to be in Atlanta, to be around family, to be in a supportive environment and in a culture and have a great mentor, someone that looked like me, um, there were just so many wins in that situation that it wasn't necessarily a step back. It was a huge opportunity, and I would just have been silly to not take it.
Sounds like it was a step forward in finding closer to your purpose.
Yeah.
And how did the MPH program help and support you in maybe this role or growing as a professional?
Gosh, my MPH program was everything. It helped me tremendously. So I went from being a senior business analyst to a BU director within about 18 months. So what does that look like? That looks like, having the right competencies, but also having the right community. And so within the MPH program, many of my professors, they were active in the field. They were some of our partners that we worked closely with. So not only did I get to learn about the work of public health and learn, the more technical terminology and understanding, but I also got to build really strong relationships with partners because working in public health is about collaboration. Collaboration is a huge word in terms of how we do our work and how we, um, help populations. So, um, being a part of the Emory community, I got to quickly build some very strong relationships with some key partners in this space. So, I really appreciate that.
Well, that makes a lot of sense, and I'm glad that it was helpful, and it seems like it was really a worthwhile experience for you. Also, want to note that you are also intentional and thinking through like this is not something that I want to do full time, but finding a way to do that part time as well, which I think just being intentional and knowing what you want is good.
Yeah, it really worked out, even financially. But I mean, undergrad, I had student loans. I'm not sure if that's the reality for everyone, but I had student loans coming out of undergrad. Shout out to management consulting for paying those off. But I didn't want to go back into that life, especially after being, you know, pretty financially stable for 7.5 years coming out of corporate. So I was intentional about those decisions as well as it's not being a full time student anymore, but continuing to grow in my role and not take on, too many financial liabilities.
Yeah, and that's a real conversation and real thoughts that I think everyone should really consider as they are taking on student loan debt or just investing in yourself and this education, because you definitely have to be mindful of what those implications might mean for your future life. But get back to your role. So you're director of the business unit informatics. What do you do in this role?
So, in my role, I would say I'll throw out percentages. I would say 50% of my role is around business development and client management. I would say the other 25% is definitely supporting and mentoring my team that really supports the work. And then the other is around like strategy and implementation. So being a subject matter expert in my field and making sure that the work that we do is of high quality and we are advancing the field of public health. So spending time thinking and being a subject matter expert and a thought partner, doing thought leadership work is also really critical in terms of moving informatics along in the space of public health. So that is really how I would describe the work that I do.
And can you tell us more, share more about your experience of being a Black woman in public health and in this global health, and how you show up, or how that has kind of shaped your experience?
Yeah, I would say, um, gosh, if I'm being fully transparent, which I am going to be, and hopefully it helps someone out there. Um, in management consulting, it's pretty much average 2 years in a row, and so um, one of the things our clients used to ask me, especially, is like, "How old are you?" So not only am I a Black woman, but I'm a millennial, and often in the titles that I carry, um, and the people that I work with, there was a large age. So not just in terms of being a Black woman, but also a large difference in terms of age. So how do I show up? I show up as Jimica, and I there's this book that I love when it comes to being a professional, and it's called The Thin Book of Trust. um, and it talks about basically, showing up and being competent, showing that you care. Um, all the attributes, I would say, are some of the core attributes you should have as a professional. So you're not going to get, just like you meet anyone on the street, they see you, they don't know you, they just see the outside of your book. But once you presenting yourself in a professional manner and being competent and actually showing that you care is so important, just in terms of how you show up and how you execute on the work that you're responsible for. So, being a Black woman and being a millennial in a leadership role in public health has brought a lot of things. You walk in the room again. You know, and let's be clear, we work in public health, so there's a lot of people that also have doctor, the title doctor behind their name. So we'll talk about that. I have my MBA and my MPH, but I don't have my doctorate. And so there's a lot that you kind of, face in terms of establishing yourself as a subject matter expert and as a leader. But I've had great mentors, so I'm definitely going somewhere with this. But I have had great mentors, people that don't look like me. So Dr. Dave Ross, who was our former CEO, president CEO of the task force, and one of the founders of PHII, people like that have been so important in supporting me in my role and how I show up in spaces and places and doing this work. So, is it common for me to go into, areas, especially as you're working in global health, and is, you know, from a leadership perspective, maybe more male dominant, into some settings that may be more archical, going into some settings where you're the only person of color, going into some settings where you're really clearly the youngest person sitting around this table. Yes, but again, I've I don't know. Growing up with my family in the South, I was that person. I grew up in church, and you know, when you were young, you had to get up and do a speech. Your Easter speech or your welcome speech, or you had to. I sang in a choir. I cannot sing. I did all of that. So when I was 10 years old, I was driving. So I grew up with a lot of confidence, I would say, in myself, and I grew up um, with a lot of self love. And I think that is so important in these spaces. So I know who I am, I prepare for the meetings and the spaces that I have to show up to, and I come as Jimica. And so, will everyone accept you? Will you deal with the norms around people having their very biases? Yeah, you will. but uh, my encouragement is to continue to show up as yourself. Be prepared. Be the best professional that you can be within your own right. I'm not saying, kill yourself or go over and beyond, in doing things unnecessarily, but show up and be who you are, be confident in who you are. And my faith has helped me even in the darkest spaces of my journey. So,
Well, I appreciate the reality and the transparency there. You also, as you alluded to, have your Master's of Business Administration from Emory University. What was that thought process of going in to get the MBA?
I've been a planner more in the more latter part of my life, and so um, I really do think about what I desire to do next. So once I got really comfortable with understanding public health and global health from my MPH and my experience, what I've learned from my projects, especially working on the technical side, is it's not always about science. So that business call and my prior experience in consulting and working with financials, and and thinking about how communities can thrive. So that piece of me, that business side of me, and that leadership perspective on who you are as a leader, how you work within organizations, how you move organizations based on what value that organization is driving. All of those things became really important to me. And I'm a person that I love school in some ways. And I have so many strong communities from being, in school. So I wanted that. I wanted that business acumen, that understanding, and then I also wanted to build a different type of community because I love different schools of thoughts as well. So I always have this this thing. It's like one of my shoes is a Converse. Like some old Converses that represent public health, and my other shoe is these like black heels that represent corporate or business. And I enjoy being on both sides of that. So I was just ready to do something different, something that I was still passionate about, and that's business.
And reflecting on that and the work that you do, how has that MBA helped and supported you as a professional?
It just helps. It has helped broaden my thinking. Um, Again, around what public health really means and how we can go about building strong communities. And so again, it is the science is so important, the programs and education that we do, but the finances are just important. How are we building and establishing businesses, and how we're preparing communities to thrive within their community. How what their skill sets look like. What does entrepreneurship look like for people, particularly for people of color or for minorities? What does that look like? What does that impact mean? What does micro lending mean for a community? What does getting any type of funding and being able to manage that funding? What does loans of any type, or just building a business? What does building a business actually entail, and how to operate it? So I think those things are, like I said, just as important to me when I think about public health or the health of a community and their ability to thrive.
And in your role as director of business unit informatics, what is something that you enjoy the most in your role?
I feel like some of these questions are so unfair, Omari. But what do I enjoy the most? Um, Ultimately, I want to make a positive impact. And so, what I enjoy the most is seeing that impact at all levels of the work that I do. Seeing that impact on my team, in terms of how they're able to transform as professionals and be excited about their work and thrive within their families. Seeing communities, the impact that we make when we come into a community and work with people of varying levels, whether we're in a green space or a space that have a higher maturity level in terms of their capabilities, and to be able to walk away from that community and see that they're able to thrive and carry on and continue to innovate and adapt as needed. So ultimately, I think what's most enjoyable is just the impact on the individual, the community, and the national levels of the work that I'm so fortunate to be able to do every day.
And then on the other side of things, maybe like what are some of the challenges that you're seeing in the global health landscape?
Some of the challenges I would say in the global health landscape is, oh,
We can skip it if you want to as well.
I'll give you my answer. I'll leave it up to you whether or not you want to keep it in. But I I believe that all people, regardless of their background, should have the ability to thrive. Um, and I believe that they should have the ability to thrive within their own communities. It breaks my heart to see the migrant crisis. It breaks my heart to see that people believe that they have to leave their cultures, their homes, their families, to have a better life. So I think we still have a lot of problems, you know, within countries and their infrastructure and their ability to thrive. Um, and doing things that, like for me, working on the tech side and seeing the impact of adopting systems and processes and a workforce um, that is able to thrive within their community is something that is, like I said, um, is one of the highlights of what I do. But just the migrant crisis and seeing people having, feeling as if they have to leave their community and go to another country to have a better life. Yeah.
Well, thank you for sharing that. And before I move you on to the Furious Five, I would like to ask, where can people connect with you, and where would you like to see yourself in the future?
Where people can connect with me, they can connect with me on LinkedIn. I think I'm pretty active there. Where would I like to see myself in the future? That's a really good question. I would just simply like to see myself as a resource and as a mentor in the future. So many people, from my teachers in elementary, middle, high school, to college professors, my family. Um, I have this concept that's called my community. So I have people that have been mentors and just super supportive of my journey to get to where I am today. So, thinking about like Maslow's hierarchy, I am moving into that state where I really want to just focus my energy of giving back to others, and being helpful in the lives of of other people at this point. So, being a resource.
Well, I appreciate that, and I will be sure to link your LinkedIn profile below so people can reach out and connect with you there.
Thank you.
So moving you on to the Furious Five, Jimica.
Okay.
Number one, what advice would you give to a student trying to pursue a career in public health?
Um, I think I may have said it already, but staying curious and remaining open to um, learning from every experience. Um, I didn't have a conventional way into public health. Like I didn't know what public health was, and I didn't really know the opportunities that lie, in public health. Um, until later in life. So I would say stay curious, remain open. There are so many roles and opportunities, regardless of your background, coming to public health. That's the other thing. People come with varied backgrounds into public health. So stay open, stay curious, and, you know, be clear at some point about, you know, things that you're really excited about, and just give it a shot.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
I consider myself to be a strategic thinker, um, and not just a strategic thinker, but a critical thinker that has a varied background. There's this concept of hard skills and soft skills, and so I would say, you know, what is it that, you know, you're technically savvy with, you know, focus on that and be really good at what you do. um, but please don't negate the soft skills or emotional intelligence. So making sure that your communication and how you interact with people, how you show up, your accountability, self accountability, and awareness, all of those things are areas that you're also focused on. I know we live in a more digital world, um, and people connect online a lot. Please get out and meet people face to face. Have that coffee, have that tea, go to networking events, get to know people. But I would definitely say I'm a strategic thinker, a critical thinker with a deep background in business analysis and doing technical implementations and development. So, but also having really strong communication and emotional intelligence skills are just so important.
Number three, what's something you're working on improving in your life right now?
I have been working on my well being. When you're on the go, and I guess it's been about 17 years since I graduated from undergrad, and I've been on the road for like 17 years. And so taking a step back to slow down a little bit and to rethink about what my needs are, both personally and professionally, is something that I've had an opportunity to do or start to do. And so that's really what I'm focused on. One of the things as I get ready to enter a new chapter, it's probably the first time I'm saying this out loud, especially on a public platform. But I'll turn 40 this year. Woo. And things are a little bit different when you get older. So, so my well-being, just personally and professionally, is something that I'm super focused on.
Well, thank you for sharing that publicly here with us first.
You can edit that out if you want to.
Number four, professionally, do you recommend anything?
um, yes. Um, I love HBR, and I think that's just a business school part of me. But the short articles, reading those, or just having some type of subscription. Harvard Business Review is a go-to for me. It is something that I think from a professional standpoint. Now, yeah, that's professionally. I won't tell you personally what I'm reading
We'll keep that one a secret.
right
And then, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
now. As I think about my younger self, and oh, I can't wait till I'm 16, or I can't wait till I'm 21, or whatever that number is. Um, and feeling like sometimes when I was younger, I had to have it all figured out. I would just simply say trust the process and be patient with yourself. I believe when you are moving, um, and throughout your life, and you're moving with purpose or intentionally. That still sounds a little bit rigid. But just trust the process. Like, you're gonna go through different stages. Things are gonna happen. Some doors are gonna open. Some doors are gonna close. That's okay. That's okay. And be patient with your process and understand your process, not someone else's process, or the expectations that others might have for you. But be in tune with yourself and what gets you excited, what gets you passionate, um, and just trust that process. And even if it doesn't seem like it's going right or it wasn't perfect or any of those things, just be patient with yourself.
Well, I appreciate those insights and that advice to your younger self. Jimica, I appreciate you coming on and sharing your story. And it was very, very fun to hear a lot about your experiences and your development as a professional.
Thank you. I really appreciate the opportunity.
The pleasure truly is mine. Housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to hit that subscribe button if you are not subscribed as yet. Leave a 5-star review and share us with a friend. Greatly, greatly appreciate you all. And I will catch you all next week. Peace.